Good afternoon, everyone. Welcome to this month's Employee Benefits Compliance webinar. As we're kicking off here and as folks are joining, you will see a polling question pop up on your screen. We often kick off our webinars with a poll because we like to get a pulse on how employers are feeling about various aspects of their employee benefits. So you'll see this month we are curious about GLP-1 drugs. Certainly these drugs continue to innovate and make headlines. So we want to get a pulse on where employers are at. Please note there are 3 questions. I think they're all pretty quick, but just make sure to scroll down. And as you are submitting those responses, I want to again welcome you to today's webinar. I am Jenny Bideau with AssureXglobal. Today we're going to cover affordability, and we would like to extend a special thank you to your local insurance benefit advisors and consultants who are partners of AssureXglobal for making today's webinar possible. We do welcome your questions today. We encourage your questions. So as you have those questions, please use that Q&A function at the bottom of your screen to submit those over to us. We will get to as many of those as we can today. I will also remind you, we do record our webinars. A link to the recording, as well as a link to the presentation slides, will be available early next week from the benefits advisor who invited you here today. And I will also drop a link to those presentation slides in the chat here in just a couple of moments. So again, if you're just joining us, you'll see a polling question up on your screen as we're getting started here. I'm going to leave the poll up for just a few more minutes as we've got some folks still coming in. I will mention we did ask that first question. So how does your benefit plan currently cover these drugs? We asked this just about 1 year ago. And 1 year ago, we found that half of employers were unsure of how these drugs were covered. And then about 40% said they were covered for diabetes only. A sneak peek tells me more of you are aware of how these drugs are covered under your plan than you were last year. But that diabetes only percent still is remaining about the same. But I'll leave this up for just a moment to capture the last couple responses. And I will also mention, we do publish the results of these polls in a document we call a market check survey. So if you'd like to review these responses in more details to better understand how other employers are thinking about this topic, keep an eye out for that market check survey that will be available about a week or so after today's event. All right, but I will give you that preview of how the responses came in for today. Again, less of you kind of don't know how these drugs are covered. So I think there's more awareness now of how these drugs are being covered under the plans. Most of you are saying you're covering them for diabetes only, although about 9% are covering for diabetes and weight loss. That's up just a little bit from how we saw last year. And we're seeing just a kind of a variety of responses across the other questions. So as always, much appreciate your perspectives on these polls. But for now, we will get into today's content. So I will welcome the Benefit Comply team. Today we have Regan Debin and Dan Brady with us. Regan, I will hand things over to you.
Thank you, Jenny. Dan and I are excited to be here today just to touch on something that it's always kind of nice when we don't have something brand new that we're going to talk about, but just something that we know impacts a lot of you, and just taking a chance to really do a deep dive and help you out with kind of the framework for this and how best to think about that. So that's really what we're trying to do around this discussion today for affordability. Affordability is very subjective from the employer's standpoint, from what employees think is affordable in regard to medical coverage, but we're really going to focus in today on, from a compliance standpoint, what the ACA defines as affordable. So what is affordability? Why does it matter? That's kind of how we're going to start things off today. We'll spend a decent amount of time talking about setting the employee contributions, what gets factored into that, what the ACA looks at as far as what's considered to be the required employee contribution, and some strategies around how employers think about that and how they ultimately set that from one plan year to the next. And then at the end of it, we'll definitely talk about how this matters both for small employers as well as for applicable large employers. But the last portion of what we talk about today will be specific to applicable large employers that are required to make an affordable offer of coverage. We've got 3 different safe harbors, and so we want to go through those, talk about how they work and strategies around which ones to use, because we take lots of questions from employers on that all the time. So with that, I'm going to kick things off. Dan's going to be watching. So if you have questions and comments as we're going through, please feel free to send those in. We'll try and watch those, and then we're going to go back and forth a bit. So I'll hand it over to you, Dan, in just a bit. But to start things off, just a level set, making sure that we all understand what the definition is of affordability that we're talking about here. This was added specifically by the ACA, so just over a decade ago now. We got this new definition around affordability. And coverage, medical coverage specifically, is considered to be affordable if the required employee contribution that is required to be paid for employer-sponsored medical coverage that provides minimum value doesn't exceed a set percentage of household income. So breaking that up just a bit, like I said, we're going to talk about that employee contribution and how we determine exactly what that is. We also have to have an understanding that this is when we're looking at a minimum value medical plan. Minimum value means a 60% or better actuarial value. Most employer-sponsored group health plans are going to satisfy that requirement. It's equal to a bronze level plan on the marketplace. So unless you have an offering that is kind of a skinny preventive only or limited medical MEC plan is what those are often referred to, those are not going to provide minimum value, but most group health plans sponsored by employers will meet that minimum value standard. We have to make sure it's a minimum value plan. And then once we have that, we have to apply the applicable percentage for the year, which does change year over year. So I'll make sure to give those to you, and we'll look at how that's changed over time. And then we apply that against an individual's household income. That's kind of the final piece of the equation. For this purpose, when we're talking about household income, it's not just the employee's pay, but it's their family income that they're reporting on their personal tax return. So it would be what's reported as the modified adjusted gross income on an individual's personal tax return. That's what we're comparing the percentage against to make sure that the required employee contribution doesn't exceed a percentage of their household income. When we're thinking about this specifically for employees, we look only at the cost of single coverage or employee-only coverage. What does the employee have to contribute to enroll in minimum value single coverage? If that amount doesn't exceed the set percentage of their household income, then it's considered to be affordable. For family members, we look at the other tiers of coverage. So maybe the employer just has single and family, so that's fine. Maybe they have all the different tiers, employee plus spouse, employee plus children, and family, whatever variety that they have. But for the spouse and dependents or other family members that may be eligible for the plan, the affordability is determined based on the employee contribution that's required for that particular tier. Again, we're still comparing it against the employee's household income, but we're able to take into account that higher amount. I want to point out that when the ACA was first passed, that wasn't true. The rule was that if the single coverage or employee only coverage was determined to be affordable, then the offer of coverage, even to spouses and family members where they would potentially have to pay more, was considered to be affordable as well. That was referred to as the family glitch, and the IRS adjusted that a few years back, and that's no longer the case. Now, for employees, it's based on that employee-only coverage, but for any other family members who are eligible to enroll, if we're looking at affordable or not, we're able to look at whatever tier they're eligible to enroll in. The reason why this matters under the ACA is two purposes. The first is the employer mandate. So applicable large employers, 50 or more full-time equivalents, are required to offer affordable minimum value coverage to full-time employees to avoid potential penalties under 4980H. This is also referred to as the pay or play. So the employer basically makes a choice. They either choose to offer affordable coverage to their full-time employees, or if they don't, the offer of coverage is unaffordable and the employee waives and instead goes and qualifies for a premium tax credit on the marketplace, then the employer has to help pay for that. So that's what that penalty is it's just the employer, instead of paying more to make the offer of coverage affordable, they would pay in then to help pay for the premium tax credit if the employees choose to go to the marketplace instead. So that's the first piece where it really matters, and that's all focused around applicable large employers, those with 50 or more full-time equivalents. But more broadly, for all individuals, regardless of whether they're getting an offer of coverage from a small employer or an applicable large employer, when they go to the marketplace and ask to enroll in individual coverage, if that's what they choose for their coverage option, they can fill out in their application and provide information about what coverage they have available through their employer and what the required employee contribution is. And ultimately, if they have affordable coverage available to them through their employer, they aren't eligible for a premium tax credit. They can't get that. But if the coverage that they have offered to them through their employment, again, whether it's a small employer or an applicable large employer, if it's not an affordable offer of coverage, then the individual could qualify for a premium tax credit to get help paying for the premiums toward that individual marketplace coverage. I promised we'd talk about some of the differences between small employers and applicable large employers and how to think about affordability. And so I'm going to start with the small employers. Again, less than 50 full-time equivalents, and be really careful with that. Small employers that are part of a larger group of entities due to common ownership or shared management and services, even if they have separate EINs, if, for example, they have 80% or more common ownership, IRS would look at them as a controlled group and combine them. And then for this purpose, they'd have to combine their FTE counts. But assuming we have a small employer that's not part of a larger controlled group or an affiliated service group, and they have less than 50 full-time equivalents, that employer is not required to offer benefits in most cases. There are some exceptions. Maybe under state law, there might be a non-federal governmental plan that is required to still offer certain benefits in accordance with state law. But for the most part, small employers are not under any obligation to offer benefits. That being said, lots of small employers still choose to do so, to attract the right talent, retain the right talent, kind of take care of their employees. We do see a lot of small employers choosing to offer benefits, including medical coverage. If they choose to do that, that doesn't mean that they have to comply with the employer mandate. They're still off the hook. They have more flexibility to set their eligibility rules. For example, they wouldn't have to define full-time as 30 or more hours per week. That's specific to an applicable large employer. They could have that be a little bit different. Maybe they decide it's 35 or 40 hours per week. And more importantly, for what we're talking about today, a small employer is under no obligation to make an affordable offer of coverage. They might choose to do so, but if they don't do so, there aren't any consequences. And so we get that question all the time about a small employer who's choosing to offer medical coverage. Do they have to make that offer of coverage affordable? And the answer is no. The employer might want to think about whether it's worthwhile to make it affordable or not, depending on what they offer. So, for example, if the small employer is able to offer a fairly rich medical plan, able to offer a fairly generous employer contribution to go along with that, it's just going to make sense for the employees then to jump onto the employer's plan. But some small employers, maybe the plans that are available are not as attractive. Maybe you're not able to offer as broad a network as makes sense for some of your employees. Maybe you just financially aren't in a position that you can make a real generous employer contribution. What you might want to think about is that if you intentionally make it unaffordable, at least for some of your lower paid full-time employees, then they would have the option, if they don't have affordable coverage through you, to go to the marketplace and qualify for a premium tax credit instead. So it's just something to think about as far as a small employer. No penalty if you don't offer affordable coverage, but just think about your employees and what makes more sense for them, your offerings or still maybe preserving the ability to go get a premium tax credit on the marketplace. For applicable large employers, on the other hand, those with 50 or more full-time equivalents, they are required to make an offer of affordable coverage, at least to their full-time employees. And if they don't do that, and if the employee waives and then instead gets subsidized marketplace coverage, the employer would owe a penalty. There are applicable large employers who choose to be more generous than required. They don't offer it just to employees that are averaging 30 or more hours per week, but they might decide to offer coverage all the way down to 20 hours per week. So they're offering coverage to some part-time employees as well. Then we get the question, well, if they're choosing voluntarily to offer coverage to part-time employees, do they have to make that affordable? And the answer is no. An applicable large employer is only required to make an affordable offer of coverage to their full-time employees. If the employer decides to be more generous and offer coverage to part-time employees as well, they don't have to make that affordable. And again, maybe it makes sense not to leave the choice for them to jump on the employer's plan if they need it, but to preserve that premium tax credit eligibility if they would prefer to go to the marketplace. Similarly, most employers who offer medical benefits don't offer it just to their full-time employees and dependents, but they offer it to spouses as well. They offer it to the family. The employer is only obligated for penalty purposes to make sure that the offer of coverage to employees is affordable, so that that single level coverage is affordable. The employer is not under any obligation to make the offer of coverage to spouses or dependents affordable. So they could potentially require employees to pay 100% of the monthly costs for the medical coverage for spouses and dependents. And again, as long as that employee only coverage is affordable, the employer doesn't have any risk of penalty. Affordability percentage, as I mentioned before, is something that gets adjusted from year to year. When the ACA was first put in place, it started off at 9.5%. It is adjusted each year, and lots of other things that we look at that get adjusted, they typically go up from one year to the next. But that's not true with the affordability percentage. And so I wanted to just illustrate this over the last decade so that you can see that. You can see it's gone up and down over time, in some cases, somewhat drastically. But ultimately, I mean, we're looking at this, we're talking about between 8 to 10%. It has never gone outside of that range. So what that means from year over year when we're thinking about affordability is that it's perhaps a few dollars one way or the other, but not huge differences from one year to the next. For employers who make their coverage that it's very clearly affordable, they have a very low employee contribution, or they aren't able to make it affordable, they're not even kind of close to that threshold, they don't have to watch this very closely. But for employers who each year are really kind of watching this threshold and doing their very best to keep it affordable for their lowest paid full-time employees, it's important to really watch this percentage from one year to the next. Make sure that you're using the right percentage and using it with the right plan year. To that point, it does matter whether you have a calendar year plan or a non-calendar year plan as far as when you apply the change in percentage. The IRS regulations that come out and adjust the percentage each year are very clear that it applies to plan years beginning in, so when they gave us the 9.02%, that applies to plan years beginning in 2025. So for a calendar year plan, the employer is going to use 9.02% for the entire plan year. Got another example here. If you have a July through June plan year, instead what you would do is you would go back and you would still be using the 8.39% right now for another month. 8.39% is what would be used for affordability calculations for July 2024 through June 2025. Then when the plan renews in July of 2025, so if you're making plans right now and setting employee contributions, 9.02% is what would be used for July 2025 through June of 2026. This avoids employers having to adjust things mid-plan year. So it would really be a pain if they set the rates for their non-calendar plan year, and then when it's switched in January, having to potentially adjust things to make sure that it's affordable for the rest of the year. Employers don't have to do that. The IRS recognizes that and allows you to just set it for your plan year and then make adjustments when your plan renews. So the next piece, we've kind of talked about the affordability percentage. Now we want to really talk about the employee contributions. And first, before I pass it on to Dan to talk about kind of how we figure out what that required employee contribution is, so I want to just talk a little bit more about strategy, because ultimately at the end of the day, this is a really big financial commitment for employers. We recognize that, and they need to think about this and really balance what's required around affordability and what makes sense insurance for their employees against the employer's costs, weighing the cost of paying enough as an employer contribution to make it affordable versus the potential penalties that an applicable large employer might face if it's not affordable for some of their employees. And I do have the penalty here to just give you a sense of how to do that analysis. Ultimately, if you have some lower paid full-time employees that you are not able to make an affordable offer of coverage to, if that employee waives your coverage and enrolls in subsidized marketplace coverage, both of those things have to be true. That's how the penalty would be triggered under 4980HB. And the cost for that would be $362.50 per month. So take that amount, think about that potential penalty against how much you're contributing toward the employee's coverage if they choose to enroll. Maybe it's a bit of a wash. Maybe the penalty is less than what you would have to contribute to make it affordable. That should go into and kind of help you decide what's a better situation for you financially. For small employers, I just want to drive the point home that affordability may still matter to your employees and ultimately whether they can go and get a premium tax credit on the marketplace. But regardless of whether your offer of coverage is affordable or not, there is no penalty risk. And a small employer, less than 50 full-time equivalents, no penalty for not making an affordable offer of coverage. And then also keep in mind, you have quite a bit of flexibility around contributions. So we can use different employee contribution splits for different classes of employees, the ACA section 4980H, and even the non-discrimination rules that are more broad outside of ACA. Nothing requires the employer to have a uniform employee contribution across all of their employees. We never recommend that employers do anything on an employee by employee basis because that opens the employer up to claims against a protected class. You know, somebody saying you did this based on my gender or my age or my health status. Even if that's not truly the case, it just kind of opens the door to that. So what you want to do is make sure that you do it based on a category or class of employees, but then there's a lot of flexibility there. Maybe it's based on a job title. Maybe it's based on a geographic location. Maybe it's based on pay, hourly versus salary, or that you're charging a percentage of their wages, those types of things. There's a lot of flexibility to play with that. And then also think about what you're contributing to employees for single coverage versus what they are paying to enroll their spouse and family members. And there may be reasons beyond affordability that you want to encourage things one way or the other there. But ultimately, from just an affordability standpoint, you're only required to make that single coverage affordable. So, for example, if you're an employer that is struggling with how you're going to help, fund the employer contributions, you may want to just really focus on making that single level coverage affordable, make the employees pick up a bunch more of the cost to enroll their spouses and dependents. Even though they may not love that, if they need the coverage for their family members, it provides more protection for you as the employer against potential penalties if you're an applicable large employer. When we are thinking about affordability, one of the things that employers, especially applicable large employers, get confused on as far as penalty risk is affordability is handled on an employee by employee basis. So you look at employee A, what was employee A offered? What were their medical plan choices? What did employee A have to contribute to enroll in single minimum value coverage? And is that affordable for employee A based on their household income, or one of the affordability safe harbors that we're going to look at in a bit? So it's possible that the employer is making an affordable offer of coverage to most of their full-time employees, and they just have a small portion of their lower paid employees that it's not affordable for. That doesn't mean that the employer is going to get penalized for all of their full-time employees. They're only going to be penalized, if at all, for those employees who got an unaffordable offer of coverage. And even then, it's only going to be if they waived the plan and went to the marketplace and got a premium tax credit instead. The final thing I want to mention here, which is really outside of what we're talking about today, and we could have an entire webinar just on the non-discrimination rules, but just because I mentioned potentially differentiating on a class-by-class basis, if you're considering that, or if the structure that you already have in place, I just want to say that we do need to be a little bit careful with that. We have benefit non-discrimination rules, one set under 125 that applies to any benefits being run through the employer's cafeteria plan, section 105H, which apply to any self-funded group health plans. And what both of those rules really look at and restrict is that employers aren't able to favor their highly compensated employees on a tax favored basis. So for example, having a much more generous employer contribution for management or for executive level employees only versus the rest of the rank and file, that's almost always going to violate the non-discrimination rules and put the tax favored status at risk for those highly compensated individuals. But on the other hand, what we've seen lots of employers do, specifically in response to the ACA and the affordability requirements, is to do the opposite of that, to make a more generous employer contribution available to their lower paid employees. And that's never going to be a problem. That's a reverse of what the non-discrimination rules prohibit. So being more generous toward the lower paid is fine. If the way that you've structured things is that the highly compensated individuals are getting something more, that's when we have to be careful and think about these separate non-discrimination rules. With that, Dan, I want to pause. I know you've been watching questions. Anything that we should touch on before we jump into your next section?
You mentioned that the penalty for affordability applies per employee. So that looks like that was one of the questions. Um, yeah. So I can dive in. Let's see. We had a question about state of Wisconsin, um, and Badger Care and whether that was different from the employee going to the market.
And
Uh,
that would be, I believe Badger Care is the Medicaid portion of
yeah,
what's
that
offered in Wisconsin, and I apologize if I'm mixing up, but that's and that would be different. If individuals qualify for Medicaid based on their income levels or other situations, that is not something that would trigger a penalty. This is specifically if they're just going to the marketplace, and I know Wisconsin has that separately as well. If they are getting individual coverage and getting a premium tax credit versus qualifying for Medicaid, that's what would trigger the penalty. But individuals who have Medicaid coverage or Medicare coverage, neither one of those would trigger any type of penalty for the employer. I did see one other question on the timing of collecting premiums, and that doesn't really matter. Whether the premiums are collected mid-month or during the month or even a month later, depending on how you've decided to set that up via your payroll cycles, that doesn't really matter as far as the actual timing of when it's pulled from payroll. It's how much, for example, if my plan year starts in January, how much do I have to pay to enroll in coverage in January? And that's what we would use to determine affordability.
And then it looks like there's one last question here for small and large group rules for ACA. Do they differ among self-insured and fully insured groups? So, um, no, for affordability purposes, when we're mostly looking at ALE status versus non-ALE status, and it doesn't necessarily matter whether it's self-insured or fully insured. It all that matters is the size of the employer. And obviously, there are different reporting requirements. Um, but for affordability purposes, no, it does not matter. So that's a good segue kind of into determining the employee contribution. This number is going to be important because it's the number that we use to determine whether the coverage is considered affordable. As Reagan mentioned, we're looking at the amount that the employee is going to be paying for the lowest cost minimum value self-only coverage. As we talked about, it's pretty common for plans to offer tiered coverage, so employee only, employee spouse, family, etc., or multiple coverage options, maybe an HDHP, a PPO. Again, we're only looking at that lowest cost minimum value self-only coverage. Where we use this number from a practical standpoint, for ALEs that are going to be reporting on 1095-C, this number is going to be included on line 15, and that can depend a little bit on the code that's used for line 14. In some cases, it's not necessary to include this number on line 15, but for just general purposes, that's what we're going to be including on line 15. If an employee chooses a more expensive option, the ALE is still reporting the contribution for the lowest cost option offered to the employee, not necessarily the plan that the employee actually elected. In some cases, employers will pay 100% of the coverage for that lowest cost minimum value plan. And in that case, the line 15 entry could be zero if the employee is not required to pay anything. Um, it's not quite as simple as just taking that number. A lot of employers offer other benefit offerings as we have listed here. So we thought we'd take kind of the next couple slides to go over how those different offerings will impact that number that you're using for the required employee contribution. So for employer HSA contributions, these are not going to affect affordability. And this is because HSAs cannot be used by employees to pay premiums for employer-sponsored health coverage. Somewhat similar for HRAs. In most cases, the HRA contributions, and again, HRAs are completely 100% funded by employers, not employees. The HRA contribution is not going to impact the employee contribution for affordability purposes. Again, this is because those amounts are not available to reimburse premiums. We have been seeing a lot of what we refer to as ICRAs or individual coverage HRAs, and employers offering ICRAs do need to consider affordability and potential subsection B liability under the ACA. A ICRA that is considered affordable is considered to provide minimum value so long as it's available to reimburse health coverage and Medicare premiums, not just qualifying medical expenses. We have the calculation here, but for an ICRA to be affordable, the employee contribution cannot exceed a set percentage. As Regan mentioned, in 2025, it's 9.02% of household income. Or what we'll talk about in a bit, employers are also able to use the affordability safe harbors. So for ICRA purposes, we're looking at the premium for lowest cost silver plan, less the ICRA monthly reimbursement amount. So what the employer is providing as far as the monthly allowance, and that's going to determine the ICRA employee contribution. The premium for lowest cost silver plan is determined based on a number of factors like age and location, and there are some sort of separate safe harbors that employers can use to determine the costs to ultimately determine whether the ICRA is considered affordable. Another benefit option that we see are referred to as flex credits, and this is essentially just employer money that the employee participant can use to purchase certain qualified benefits. How this impacts the affordability determination depends on how the credits can be used. If the credits are restricted to health coverage, so medical, dental, vision, or the health FSA, the credit will decrease the employee contribution. If, however, the credits can be used for non-health coverage, then it will not decrease the employee contribution. And we have an example here. So let's say the employee's cost of single medical coverage is $500 a month. The employer provides $300 a month in flex credits. Again, we're looking at what those credits can be used for. So if the flex credit can be used only towards the medical, dental, vision premiums or health FSA, then the monthly contribution is going to be $200. So essentially the employer gets to add that flex credit into the determination for the required employee contribution. If, however, the credits are unrestricted and they can use them for life, disability, dependent care, or cash, then that but then the flex credit are not going to impact the required employee contribution. So there is no adverse effect on affordability. The employer just won't be able to make the coverage essentially look more or sound more affordable. Another popular benefit offering that we see are opt-out incentives. Just a little background on an opt-out incentive is essentially an arrangement where the employer offers an employee a certain amount of money um, that they're paid to waive coverage under the employer-sponsored group health plan. As with some of the other benefits, the impact on affordability is going to depend on the specific arrangement. And in this case, we're looking at whether the arrangement is considered what the IRS refers to as an eligible opt-out arrangement. An eligible opt-out arrangement is when the arrangement is conditioned on the employee providing reasonable evidence that the employee and their family have or will have other medical coverage other than individual coverage during the period that the opt-out applies, so typically during the plan year. So the most common example that we'll see is an incentive. An opt-out incentive is available only if the employee signs an attestation stating that they and their family have coverage under their spouse's group health plan. That would be an eligible opt-out arrangement. If the arrangement is eligible, then the incentive amount does not impact the employee's contribution. And these are also referred to as conditional opt-out arrangements. If the arrangement is not considered eligible or is unconditional, meaning the incentive is available to anyone who waives coverage, you don't have to show proof of other coverage, then the amount of that incentive is included in the employee contribution for affordability. And we have an example of that. And I forgot to mention this again. So when I talk about options for other coverage, we get a lot of questions about, well, what other coverage can the employee enroll in and still be eligible for the opt-out incentive? And generally speaking, that is going to depend on how the employer wants to define and design their incentive program. But there are some important restrictions. First of all, healthcare reform prohibits the employer from paying or reimbursing employees for individual health insurance. So the opt-out cannot be provided for an employee who waives group health plan in order to enroll in individual coverage other than through an ICRA. And then also many of you have probably heard of the Medicare secondary payer rules. These are generally going to apply to employers with 20 or more employees. And those employers are prohibited from incentivizing Medicare eligible or entitled employees to decline coverage under the employer plan in favor of taking Medicare. So essentially, the employer cannot say to a Medicare eligible employee, hey, we're going to pay you to drop our coverage and join Medicare. That would violate the MSP rules. We have some sort of back and forth guidance, informal comments suggesting that the employer could offer an opt-out to everyone, and it's okay as long as all who waive or all who show proof of other coverage and not just those providing proof of Medicare are eligible. And then we had some sort of back and forth CMS guidance that contradicts those informal comments. So most often, the safest approach is to offer the opt-out only to employees who elect other group health plan coverage. For example, through a spouse. You certainly don't want to be conditioning the incentive on an employee going and getting Medicare instead of the group health plan. So kind of getting back to our example here and how it's going to impact affordability. Let's say you have the employee cost of $125 a month with an opt-out credit available of $50 a month. If the opt-out is unconditional or ineligible, then any amount available to the employee who waives coverage for any reason, that amount of the credit is going to be added to the employee cost of coverage. There are some limited exceptions for opt-outs that were in place prior to December 15th or December 15th, December 2015. We typically don't see that very often. If the opt-out arrangement is eligible, and again, those are arrangements where the employee has to show proof of other non-individual coverage, for example, through a spouse, then the affordability contribution is unchanged. The employer doesn't have to add that $50 a month credit to the calculation. The last sort of benefit offering one I talked about, which is very common, is wellness incentive. So a key factor here is going to be whether the wellness incentive is related to tobacco use. For example, employers will offer smoking cessation programs or signed affidavits relating to tobacco use. That's going to be the key in determining how the incentive itself impacts the employee required contribution for affordability purposes. So the general rule is that an incentive under a non-discriminatory wellness program that reduces the amount of pay the employees pay for cover that the employee has to pay for coverage is generally not taken into account unless the program is designed to prevent or reduce tobacco. So put another way, affordability is determined assuming the individual fails to satisfy any wellness requirements unless the requirement is related to tobacco. So as you can see our example here, let's say the employee contribution is $200 a month and they have the opportunity to reduce it to $150 a month with the wellness incentive. So for line 15 purposes, back to the 1095C, if the incentive is not tobacco related, then the amount we're putting in line 15 is $200, even if the employee actually received that non-tobacco incentive. If the incentive is tobacco related, then we're putting $150, the lower amount, regardless of whether the employee actually qualified for the tobacco related incentive. It's common for programs to include both tobacco and non-tobacco incentives, and in that case, still only the tobacco portion of the incentive is included when for purposes of reducing the employee cost.
All right. Thanks, Dan. And we're going to jump into now the last kind of main section that we're going to cover is focusing in on the affordability safe harbors. So you kind of remember back to my original definition at the very beginning, we talked about household income. We've talked about that and applying the applicable percentage, which is 9.02%, and looking then against the employee contribution. So the last piece that I really want to focus in on here, since we talked about the percentage and the employee contribution, is household income. And I mentioned it's a modified adjusted gross income for the family. And employers are not typically going to know that. They're only going to know what they're actually paying their employees. And so the IRS recognized that and said specifically for applicable large employers where this really matters for employers to avoid potential penalties, they gave us 3 different affordability safe harbors that we can use. And ultimately, as long as the employer is meeting one of the 3 safe harbors, whether it's affordable on their household income or not becomes irrelevant. For penalty purposes, the employer is protected as long as the offer of coverage meets one of the 3 safe harbors. And those are the federal poverty line, the FPL safe harbor, the rate of pay safe harbor, and the Form W-2 safe harbor. And again, we've got some flexibility here, kind of like I described with the different employee contributions, that employers can actually apply different safe harbors for different categories of employees, again, based on things like job class, compensation type, or geographic location. The reality is that it's often more practical and easier administratively just to pick one and use it for all full-time employees, but it is potentially possible to use it differently for different categories of employees. It is also a possibility to change safe harbors from one year to the next. So for example, if the employer used the Form W-2 safe harbor in 2024, they decide the rate of pay safe harbor is a better fit for 2025, that's not a problem. It can be switched from one year to the next, regardless of what was previously reported. And then the next thing to think about is that we often see employers use this in 2 different ways. So selecting it differently from one year to the next, and then using that both on the front end to potentially set employee contributions. So the employer may, hey, we're going to look at our kind of lower paid full-time employees, use the safe harbors to ultimately calculate what we think will make it affordable for most of our full-time employees or enough of our full-time employees. So it's just to kind of set that employee contribution rate. But then the third step is that ultimately when the employer gets to the end of the year, regardless of what they use to set those employee contributions. So for example, maybe the employer decided to use the rate of pay because they could kind of base it off of their lowest paid hourly employee and do the calculation, likely to be affordable for most. But they get to the end of the year and things didn't play out the way that they expected. And they decide they want to run the other safe harbors as well and see which one provides them the best level of protection. Ultimately, the employer doesn't have to pick which safe harbor they're using until they're actually doing their reporting on the 1095Cs. Then at that point, the employer has to pick what they're using, or at least for each category of employees, if they're going to use different safe harbors for different categories, and then use that when they do their Form 1095C reporting. So I want to go through each one of the safe harbors and give you a little bit detail on how those work and where they might be a good fit or not as good a fit for you. I want to start with the simplest one, the federal poverty line, the FPL safe harbor. This is the simplest calculation. It's also the most conservative approach. If you can satisfy this standard, your offer of coverage will be affordable for all of your full-time employees, regardless of their hours, regardless of what level of income they ultimately have. The only tricky part about the FPL safe harbor is that the FPL guidelines are adjusted by the Department of Health and Human Services each January. So for a calendar year plan, we have to look back and use the previous year's guidelines. For non-calendar year plans, we can use the current year guidelines. The IRS has said we can use the FPL guidelines in effect within 6 months of the beginning of the plan year. So that's why when you look down to the very bottom of the slide here, we've got different thresholds for a calendar year plan versus a non-calendar year plan. They're both using the 9.02%, but for a calendar year plan, we have to base that off the 2024 FPL guidelines. So that puts it at $113.20 per month or less for a calendar year plan in 2025. Versus a non-calendar year plan starting in February or later of 2025 can use the current 2025 FPL guidelines, and they do go up from one year to the next. So a non-calendar year plan can get away with charging up to $117.64 per month or less and meeting the FPL safe harbor for 2025. I do want to note that this is specifically tied to calculations on the mainland FPL guidelines. For employers in Alaska or Hawaii, you're allowed to use those FPL guidelines, which are significantly higher and would allow an even higher amount to meet the federal poverty level safe harbor for the employees in Alaska or Hawaii. The second option is a rate of pay safe harbor. We do this a little bit differently. The calculation is slightly different depending on whether the employee is hourly or salaried. So we'll look at hourly first. We have to pick their hourly rate, and we have to use the rate that's in place at the beginning of the coverage period, which is either the beginning of the plan year or if they join mid-year when they first become eligible for the plan. And even if they get a raise sometime during the year, we can't take that into account. We couldn't take that into account until the next plan year. Then we take that hourly rate, multiply it times 130. It's always by 130, not based on the actual hours that they worked. So if they worked more or less than 130 hours per month, that doesn't matter. We always do it times 130. And then we apply the year's percentage. And then ultimately, the employee contribution can't exceed that amount. So if we have an employer who is looking at using this particular safe harbor, they look and they say, out of our full-time employees, the lowest paid one is $14 per hour. So we do the calculation, and that would mean that ultimately $164.16 per month or less is affordable. So that $14 times the 130 times 9.02% for 2025. If instead it's a non-hourly employee, a salaried employee, instead of doing the hourly times 130, we just take their monthly salary. We don't have to figure out an hourly rate. We apply the percentage for the year times 9.02%, and then their monthly amount can't exceed that amount to meet the rate of pay safe harbor for a non-hourly employee. The one thing to be careful of with the rate of pay safe harbor is that it can't be used specifically for a salaried employee. If their salary is reduced during the year, then it's not available. The other thing is that whether they're non-hourly or hourly, if they also are paid with tips, commissions, or they have significant bonuses during the year, you're not able to take that into account. The rate of pay safe harbor is always going to be calculated off their base hourly rate or their base monthly salary. So if your workforce has a group of employees or most of your employees that a big part of their compensation is tips or commission or bonuses, this might not be the right safe harbor for you because you're not going to be able to take that into account in doing the affordability calculation. Instead, what might be the better fit is the Form W-2 safe harbor. The Form W-2 safe harbor, instead of looking at an hourly rate or monthly salary, takes ultimately all of their taxable wages, including bonuses, tips, commissions, any other compensation that they receive during the year that is reported as taxable wages in box 1. That's what we get to look at. And then we apply the percentage against those box 1 wages, and the annual contribution, whatever they're required to enroll in coverage over the year, can't exceed 9.02% of their annual wages that get reported in box 1. Or if you want to get a monthly rate out of that, you can divide that calculation by 12. The only limitation for this particular safe harbor is that the required contribution has to remain a consistent amount or a percentage of their Form W-2 wages. So for example, if an employer for whatever reason sets their contribution rates and midway through the year, they have to make an adjustment to their employee contribution amounts, this Form W-2 safe harbor wouldn't be available. On the other hand, though, in one way to kind of tackle affordability, we've seen lots of employers set the employee contribution at a percentage of wages. For example, maybe the employer charges all of their employees 9% of their payroll each time. That is what is their employee contribution level. That would be okay under the W-2 safe harbor and would likely result in an affordable offer of coverage. I do have a couple examples because this particular safe harbor can be a little tricky for employees who are only employed for a portion of the year or only eligible for a portion of the year, and the IRS gave us specific instructions on how to do that particular calculation. So my first example there is an employee that is offered coverage all 12 months, then it's very straightforward. Employee has box 1 wages of $30,000 for 2025. Be careful here. We won't know their box 1 wages until we get to the end of the year. So we're always doing a bit of a guesstimate with this safe harbor. But we get to the end of the year, we're preparing the Form W-2s, and this particular employee has box 1 wages of $30,000. So we take 9.02% of that. And then if we want to get a monthly rate, we divide that by 12 months of coverage. That would mean that an employee contribution of $225.50 per month or less is affordable under the Form W-2 safe harbor. The second example, we have an employee who was employed only 7 months out of the year, and they were offered coverage only 5 months due to a 2-month waiting period. They had box 1 wages for the year of $18,000. So what the IRS tells us to do is to do a fraction of their box 1 wages. The number of months that they were offered coverage, 5, over the number of months that they were employed, which in this case was 7. So 5/7 of that $18,000. That's the first part of the calculation. And then again, now we just apply the year's percentage, 9.02%. If we want to get a monthly amount, because we're looking at 5 months of coverage, in this scenario, we would divide by 5. That would mean that for this employee, $231.94 per month or less is affordable for 2025. So those are the 3 potential safe harbors. Kind of just going back, and this is maybe already clear based on how I described these, but you always look to the FPL safe harbor first. If your employee contribution is approximately $100 per month or even $110 per month or less, you meet the FPL safe harbor and you're done. You should use that. It's going to be affordable for everybody. You're in good shape. You don't have to worry about it any further. But I appreciate that not all employers can afford to do that or choose not to do that for different reasons. They have to put a higher employee contribution in place. That doesn't mean that your offer of coverage is unaffordable. It just means that you don't meet the FPL safe harbor and you have to look to the rate of pay or Form W-2 safe harbor instead. You can just run the numbers based on what we just did, and a lot of employers will do that. But just to give you a sense of kind of where one might work better than the other, the rate of pay safe harbor is often a better fit if you have a lot of hourly or variable hour employees, and they might work more or work less, and you don't have a good sense of ultimately what their box one wages are going to be. It's always locked in at their hourly rate times 130, so then you don't have to worry about that. It also can be used with more certainty at the beginning of the plan year. You know their hourly rate or you know their monthly salary. You can do the calculation, set the employee contribution, and you should be fine. On the other hand, the Form W-2 safe harbor, as we talked about, is going to allow you to take more compensation into account and potentially allow a higher employee contribution to be affordable, especially for those employees who consistently work more than 30 hours per week and have bonuses, tips, commissions, other type of compensation to take into account. The only downside of the Form W-2 safe harbor is that you're not going to know until the end of the year. So you can make a guess, you can look, on average, this is what our full-time employees typically had as far as box one wages in the previous year, and then set your employee contributions accordingly. But it is a little bit of guesswork, and there is a chance then when you get to the end of the year, some of the employees may not shake out as expected. Dan, I'm going to turn it back to you just to wrap up with our final couple slides here.
Yeah, so we just wanted to point out a situation which we referred to as the affordability paradox. Basically, this says that there can be a time when coverage is both affordable and unaffordable. Essentially, it will be unaffordable when you're looking at the employee's household income and affordable under one of the safe harbors that Regan just went through. Um, the individual, as we've talked about, can be eligible for the subsidy even if their household income, based on their household income, if it's unaffordable, they can be eligible for the subsidy, even if one of the safe harbors determines that the coverage is affordable for ACA purposes. Not a situation where the employer needs to worry in terms of those penalties that we've talked about. As long as the coverage is determined to be affordable under a safe harbor, then there won't be any subsection B penalty liability. And we just sort of have an example of how that would shake out here. Using the rate of pay safe harbor, you could come up with a contribution of $140. If you're looking at the employee situation, there is a situation where their household income may result in that $140 employee contribution being over the 9.02%, resulting in the coverage being unaffordable for subsidy purposes. So they could qualify for the marketplace subsidy, but the employer would not face any penalties under subsection B because using the rate of pay safe harbor, the coverage would be deemed affordable. And then just to wrap up, a couple takeaways. Again, affordability matters. It's important for determining Section 4980H compliance, and we want to make sure that ALEs are not getting hit with those subsection B penalties. As I talked about, there are a number of different factors that can contribute to how we're determining that employee contribution, flex credits, opt-outs, wellness, etc. The various safe harbors, it's pretty common. I think that a lot of employers really aren't aware of the flexibility they have in using the different safe harbors. A lot of them think they're kind of locked in year after year, or locked into using the same one for every employee, which is not necessarily the case. And then, as we've talked about, there can be a strategic approach to this. So it's important to balance affordability compliance with cost management and your employee needs.
We didn't have any additional questions that
Yeah.
I saw come in that we didn't get to. So I think that's it. And we'll turn it back to you, Jenny. Thanks everyone for joining us today.
Excellent. Well, thank you both. You both are always such a wealth of knowledge. Appreciate you sharing that with our audience. And to our audience, thanks for tuning in. As a reminder, if you are looking for a link to the recording, You can find that from the benefits advisor who invited you here today. They are also a great source if you have any more questions or want to dig into anything else that was covered today. So please do reach out to your benefits advisor for that. And again, thank you to those advisors who are partners of AssureXGlobal for making today's webinar possible. That does conclude our time together. So thanks again for joining us and have a great afternoon.